Okay, Donna, you're good.
Good afternoon. Hello, I'm Donna with Aging Advantage, and we are here again with another talk for you today. And as you know, sometimes we do the ARPA talks, and that's what we're going to have today. The ARPA talks are through local grants and donations. We offer programs to help with effects of COVID and other post pandemic situations, like the housing and food insecurities, or even isolation. So, through this partnership, we provide educational topics that can help promote self care and resilience. So today's speaker is going to be Dr. Hedva Barinholtz Levy. And she is going to take it away and just share a little bit about what she has to offer. Okay. Welcome, Dr. Hedva.
Thank you so much, Don. I appreciate the chance to share some of this information with everybody today. So I am a pharmacist. I specialize in working with older adults, and I have a practice in St. Louis, Missouri, where I work with older adults in their homes and family caregivers to help identify medication-related problems, help people get a handle on the medicines they're taking, and prevent the overuse or harmful use of medications, which is unfortunately far too common as we get older. So today I'm taking a little twist on the medication piece. I'm certainly wearing my pharmacist hat as I speak with you, but I wanted to talk about age-friendly healthcare, if you will, with a little focus on the medications, and leave all of you caregivers, maybe patients, older adults yourselves, with some interesting information that can help improve the care, your health care, your interactions with your physicians, with your pharmacists, with even your physical therapists or whomever else you're working with. So I am a geriatrics pharmacy specialist. I also teach at the St. Louis College of Pharmacy part-time, and I am author of a book called Maybe It's Your Medication. So I'm going to share a little bit about that more at the end, but all of what I'm about is helping people understand their medicines and use them more safely. So this is I really appreciate the time with you guys today. So what I was going to walk through in the next, I don't know, half hour or so is we'll talk about age-friendly care, what this movement is all about. I want to talk about, introduce you to the 4Ms framework. I'll let you know what that is, and then how you can apply this information. And we'll time for question and answers at the end of the talk. So do jot your notes down. Um, so what is this age-friendly healthcare all about? So the age-friendly health systems movement was developed in 2017 by the Institute of Healthcare Improvement and the John A. Hartford Foundation. And these are two big organizations that are all about improving healthcare in America. So the goal of this age-friendly health system initiative was really to improve care as we get older, avoid harm associated with the healthcare, and increase the satisfaction of care that each patient receives. So, and the main goal is to look at the crux of it is to respect the older adult or the patient, acknowledge that their quality of life can greatly improve and their health outcomes improve if we really focus on meeting them where they are, with what's most important to them and what their current needs are. And those needs can change over time, of course. But we need to check in with the older adult, with the patient, at each point of the healthcare journey to make sure we're providing care that meets with what matters most to them. And the this program, so this age-friendly health system, which, as I mentioned, or as is on the slide, was created or developed in 2017. It's being rolled out across the country with some greater level of intensity or earnestness to get the word out. So it's been around not quite 10 years, 8 years it's been. So it's not a super new program, but it is just getting started, if you will, in that rollout across the country. And there's a next level of helping patients and caregivers be aware of this age-friendly healthcare movement, if you will. So that's why I'm eager to bring it to you, because I think there'll be some interesting tools for you or helpful tools for you to take from here. So the age-friendly health system, in looking at the graph on the right, or the picture on the right, is the overall concept. And within that age-friendly health system movement, or this age-friendly healthcare idea, is this four M's framework. And I'll talk about there's these four M's that fall into that, four words that we'll be talking about in just a second. So what's the importance of even thinking about an age-friendly approach to healthcare? So on this slide, I just wanted to kind of hit the highlights, if you will. Think about the care that you are, maybe you're experiencing yourself, but the care that your older adult loved one, the person you're caring for, is experiencing. We have a very complex healthcare system in America, and unfortunately, it's somewhat ill-equipped to provide quality of care to an aging population. And why is that? One thing I often talk about is that not very few, less than 3% essentially, of healthcare professionals are geriatric trained. So, and geriatrics refers to the older adult population, 65 and older. So all the healthcare providers don't have that expertise, and the sense of the complexity of caring for patients as they get older. As you probably are well aware of, we have a growing aging population. 46 million people are age 65 and older right now, and that's going to more than or essentially double to 90 million by 2050. You might have heard the statistic that 10,000 people are turning 65 every year. And I've heard most recently, as we're nearing later phase of the end of the baby boomer generation turning 65, that's even more than 10,000 persons per year turning 65 and older. So we have this growing aging population. Older adults typically have multiple chronic conditions. 2/3 of Medicare beneficiaries have at least two chronic conditions. Um, Older adults who are 80 and older, 85 years and older, commonly have six health conditions that they have to manage. And with those health conditions come multiple medications. We also have a system where I think you see a lot of fragmented care. We have specialists. The statistic here is that among Medicare beneficiaries, they see an average of 5 specialists a year on a regular basis. If all those specialists are prescribing medications, I certainly think about the concerns as a pharmacist when we get all the combinations of medication and that risk of overuse of medication, overprescribing of medication as well. And that leads us to my last point of the multiple medication use. 42% of people age 65 and older take 5 or more medications on a regular basis. And that percentage has steadily increased in the last 30 years. The use of 5 or more medications, we call that polypharmacy. So if you've not heard that term, I encourage you to be familiar with the term polypharmacy. It refers to taking 5 or more medicines, and it's essentially a risk factor for having health-related problem or medication-related problems. So we do worry about just not only the number of medicines, but is it the right combination? And when I start talking about these four M's in just a minute, you'll see how the medications play a really integral role. So this movement is important because I think we recognize that we can do better in the care we provide older adults, and this age-friendly movement and the 4Ms framework provide some really important guideposts that not only do healthcare professionals need to think about, but patients and caregivers need to think about as well. So finally getting to the 4Ms framework, which is the crux of this age-friendly care. The 4Ms stand for matters most, or what matters, medication, mentation, or mind or mood, if you will. And then the fourth one is mobility. And I'll talk about each one of those in just a second. But with the age-friendly care proposition, if you will, this initiative, the 4Ms framework gives us a common language. And by us, I'm referring first of all to clinicians, so any of us caring for older adults, but it's something that the patients and other stakeholders in the healthcare system can easily adopt and pay attention to. And when we all think about the healthcare we receive in the healthcare system, or the healthcare as we provide it from the professional end of it, it leads to improved health outcomes and better quality of life. What's really nice about this 4Ms framework is it's evidence-based. What does that mean? Maybe you've heard that term already, but it simply means that in putting together this framework, thinking about what are the main pillars of providing better care to older persons, they looked at programs that are currently in place. They looked at hospitals that have aging care units. They looked at other geriatric models. And from the literature that showed better outcomes when you focus on certain aspects of healthcare for an older adult, the evidence shows that there are better outcomes and better quality of life when we think about focus on these 4Ms in specific. If you think about each of these components, the what matters, we'll talk about the patient preferences. That's what the what matters is, the medications, the mentation or the mood, and the mobility, they're all interrelated. And certainly as a pharmacist, the medications, well, I'll talk about how they clearly can affect one's cognitive function, their mind, as well as their movement ability, the mobility piece, when we think of side effects of the medications. But even having some level of cognitive impairment, maybe it's dementia, that might affect the person's ability to move and get around and accomplish things they need to accomplish on a day-to-day basis. So they're all very interrelated. This 4M framework applies across healthcare settings. So um, hospitals can apply this 4M framework, ambulatory clinics where you might go for your outpatient healthcare visits, urgent care facilities could apply this 4M framework, certainly long-term care facilities, nursing homes, and even short stay rehabilitation units can all apply this 4M framework. It applies to the healthcare providers, as I see it from my perspective. When I work with an older adult, I want to make sure I'm thinking about each of these M's in the 4M framework, but it also applies to patients and caregivers, right? So as you are aware of this 4M framework, I'm hoping that you will make sure each of those M's are addressed with your at each healthcare visit with your healthcare providers. So we'll again go into each one in just a second. So it's broadly applicable, evidence-based. We really need to be aware of and adopt this 4Ms framework and age-friendly care. All right, so we'll talk about each one, a slide for each, but kind of highlight this already. But here's again the graphic of the 4Ms framework is it really summarizes it nicely. So the what matters piece, we want to know and align care that we provide with each older adult's specific health outcome goals and their preferences. So and it can look at end of life care, but it also has to do with even day-to-day management of your health conditions. Medications are really important because we need medications to manage these chronic health conditions, but we need to choose those medications carefully and use age-friendly medications. I like that term. And I'm going to talk to you a little about some medications that are not so age-friendly. And it's important to be aware, not necessarily of the specific medications, but know that we need to be talking about our medications and how those medicines might affect patient preferences, the matters most portion, but also mobility and the mentation or mind piece. Mentation refers to is the term they use in this 4Ms framework to talk about the importance of addressing dementia or any kind of cognitive impairment, depression, and also delirium. That we can screen for these problems and address them early, hopefully to improve quality of life and health outcomes. And then mobility is that piece of looking at how the person moves around safely. It could be day to day within the home. It could be transportation, getting to a pharmacy or a healthcare visit, for example, or even being able to be mobile enough to go visit family members, be with grandchildren, whatever is important to the patient. So I'm going to go through each one separately, a little bit more, some other thoughts about them. So the what matters piece or matters most, that's the first M. And some of the considerations are the patient care preferences. So how does the person want to receive care? Is the person very open to I want to say maximal intervention, but having intervention, or would they rather go a more natural route? Are they more resistant or cautious? before accepting another medication or before saying, sure, I'll do the surgery versus what are the other options if I don't do surgery? So what are the care preferences of the for that person? And we need to prioritize and ask, what are the health outcome goals? And this can vary from person to person. It might vary from year to year, even depending on how a person's health has changed or circumstances around them. What are their health outcome goals? To be able to lose a little weight, or to be able to carry on the way they have been with their lifestyle without having to make too many changes, for example. And I think a real important consideration here is to think about what care the person does not want. So what's the unwanted care? Because when we think about the expenditures across healthcare, billions and trillions of dollars, a lot of that goes to unneeded or care that maybe the patient didn't want to have in the first place. So it's something to think about what not only what the person wants, but what they don't want. And when we talk about what matters most and bring that into the healthcare and really focus on that, it's going to involve a collaborative goal setting process, where you're talking about with the healthcare providers, with the physicians, nurses, different therapists, etc., about the benefits and harms of the different therapy options. It could be adding a medication. It could be doing a surgical procedure or something more invasive. It could be going for a physical or occupational therapy or nutrition counseling, whatever it might be. But what are the risks and benefits? We also have to think about prioritizing how we manage a person who has several health conditions by to make sure we're not overburdening the patient with excessive uh, medications and expectations of monitor this and change this lifestyle and take on this extra exercise program and change what you're eating or whatever it might be. By if we look at managing different health conditions and the guidelines for each of those conditions, it could be overwhelming if we really treat each condition as thoroughly as we can. I don't know not how to I want to word that carefully. But sometimes we have to think about the burden of medications and monitoring and lab tests and changes we're asking the patient to make, because it can be too much. How do we balance the different health conditions with what matters most to the patient and provide the person with the best quality of life and best health outcomes based on what matters most to them? So these conversations are important at every visit and along the health journey, if you will. And sometimes the conversation can start if you're not, if you're not sure to think, it's hard to think about what are my preferences or what is my care person's preference. Talking about the advanced directives and healthcare power of attorney, um, these documents are very important for in the healthcare realm. That might be a starting point to talk with your loved one, the person you're caring for, and even for yourself. What do I want at end of life? But these conversations also go before the end of life conversations as well. But that's just an example. The next M, I'm going to save medications for the end. So going to the mentation, or we can think about it as mood and memory, is another way to think about that M. As I mentioned before, we want to look at depression, dementia, and delirium. Those are very important, but easy to identify and in many ways manage, prevent. We like to prevent delirium if we can, but we have to look for it. We have to know to screen for it. So that's an important piece. And so I think from your perspective, as a patient or caregiver, you want to make sure the care team is looking at this mood and memory aspect. So there's that screening for depression and cognitive changes, preventing delirium. We're probably at highest risk of developing delirium in the hospital, but I certainly have seen patients who are living at home with just the wrong combination of medications and a health situation that maybe they could experience delirium at home even. So make sure the person has their hearing aids and eyeglasses on if they use either of those. So that when they have a conversation, they're as oriented as they can be and they can hear and see and participate. Addressing social isolation, we know, is really important when we think about preventing cognitive decline as we get older, as is hearing. So those aspects cannot be overlooked. And then in general, to maintain, to maximize our mental health well-being, our mood and memory, our cognitive mind function, these healthy eight behaviors, life's essential eight, as they've been called by the Heart Association, are really important. So these are concepts you might want to be asking of the healthcare team. How can we need to make sure that the person's blood pressure, cholesterol, and diabetes are well controlled, but also address physical activity, hopefully quit smoking if the person is a smoker. How is the person's sleep going? Can we make sure we're getting good 8 hours of sleep if possible? Weight management is important, and then a healthy diet. So all those go into helping the mood, the mind, the cognitive function, and even depression. But we have to address these as part of our healthcare process. For the mobility piece, we want to make sure the patient can move safely to maintain the function. You want to maintain the muscle mass so the person can keep moving and do what matters most, right? As I mentioned earlier, it could be being with family and loved ones and grandchildren. It could be getting to the office visits, for the healthcare visits. It could be getting to the pharmacy, whatever it might be, or even the grocery store, all those daily things we need to do. So some things with mobility that should be talked about, and some things that you could be thinking about that you might want to make sure is always talked about with the healthcare team. Ambulate, getting up and moving around every day. If the person is in the hospital setting, it's important that 3 times a day the person can get up and move around if that's at all feasible. And one thing that's talked about is bringing in the caregivers in this age-friendly approach to healthcare to make sure the caregiver knows how to assist with helping the patient, the older adult, move around. And when we think about the person moving from the hospital setting to home, we refer to that as a transition of care. Does the caregiver know how to help ambulate, get the person up safely and use transfer to a wheelchair, or use the walker or whatever it might be, to navigate that mobility safely at home. So maximizing activity, maybe setting daily goals. It's something we can work on with that collaboration between the clinicians, the healthcare providers, and the caregivers or patient. Set some goals to make sure the person is maintaining strength and able to move as much as possible. From like when I think about the medications from a pharmacist standpoint, I would think about the patient having their pain adequately managed. That again, the strength and balance is a little bit more with physical therapy or an exercise coach of sorts. But I want to look at the high risk medications. And as I mentioned before, things are interconnected. High risk medications can increase drowsiness, might increase the risk of muscle weakness, and therefore contribute to the fall risk, for example, which would be devastating. We want to avoid that. And then include things like physical or occupational therapy when needed to help with that mobility piece. So these are things you can be thinking about with mobility to maximize outcomes in the healthcare experience. And now we get to my favorite part, which is the medications. As a pharmacist, this is where I focus on it. Where my focus is, shall I say. So with medication piece, what does the 4M model tell us? It says we want to avoid harmful or unnecessary medications and avoid high risk medications whenever possible. So I have on the screen here the 7 categories of high risk medications, and I'll just touch on them briefly. I don't have specific medicines on the slide. Didn't want this to be an overwhelming medication focused talk, because medicines are one aspect, an important aspect of this age-friendly care. But there's so many medications, it would take an hour or 2 hours to go through all of them of sorts. So to give you an idea though, benzodiazepines, it's a big name for a group of medications, a family of medications, if you will, that are used primarily to treat anxiety. There are some other occasions, reasons we use these drugs, where we definitely prioritize and use them safely and appropriately in older adults, maybe for seizure treatment, for example. But when we use them for anxiety or sleep, we need to be very careful because they are higher risk for older adults. They can affect not only mentation, the cognitive function. Long-term use is associated with decreased memory and the risk of dementia. but the drowsiness factor that can increase the risk of falls. Sedative and sleep medications equally we want or have that risk of the drowsiness factor. So these are some of these medications that are specifically for sleep include uh, the Zolpidem, Ambien, Lunesta, and Sonata. Those are brand names of some of these Z drugs they're called that are for sleep. Among the benzodiazepines, just to go back to that one, you might be familiar with drugs like lorazepam or Ativan, Xanax or alprazolam. Diazepam is one that's been around for eons, called Valium is its brand name. So those are the benzodiazepines we want to be very careful about. These I mentioned the sedatives, so anything that can contribute to that drowsiness that we use for sleep, even trazodone, and then there's a newer group of medications. They still carry that risk of that the sedation piece, so we worry about them uh, affecting the mobility and then in some cases the mentation. Opioid pain medicines. Oh, these are things, these are very strong and strong pain medicines, things like hydrocodone, Norco, oxycodone, morphine. Those are opioid pain medicines. Those can increase drowsiness, some the fogginess of the brain, if you will, and lead to fall risk is our main concern with them. Anticholinergic drugs, it's a big name, big word. I get that. I do talk about that whenever I speak to older adults, to patients and caregivers, because it's important that you understand there's a lot of there's some concerns with medicines we need to be aware of and have these conversations. So anticholinergic drugs just refers to how they work in our brain, certain receptors they impact, and because of that, it leads to a group of certain side effects that we worry about in older adults. And I'm going to highlight the confusion and decreased memory in older adults. These anticholinergic drugs, and there's a variety of them, um, also are we're concerned that it increases the risk of long-term cognitive problems, dementia, basically. So we really want to minimize our use of drugs that have these anticholinergic properties. And just to, so really you'd have to talk with your pharmacist to find out, am I on an anticholinergic medication? But some of these medications are used for treating overactive bladder. Some of the older antihistamines, something like diphenhydramine or Benadryl, if you've heard of that, is a good example of an anticholinergic medicine that's probably not a great choice as we get older. Some of the antidepressant medicines, some drugs that we use to treat Parkinson's disease have these anticholinergic effects. Um, Antipsychotics, some of those. So it's across the different drugs that we use for different reasons. But I just highlighted something you might want to be familiar with to talk to your pharmacist about. Muscle relaxant medicines, things like Flexeril or Soma, we worry about that they may not be super effective in older adults, but they certainly come with that risk of drowsiness and fall risk. So we want to be careful how we use muscle relaxants. Some of the antidepressants, well, I should say, many of them are associated with increased fall risk. So we think about that, how medications can affect the mobility piece. And then antipsychotic medicines, and those can be used sometimes for bipolar disease. They can be used added on for treating a very severe depression, but we also see them used in patients who have dementia and those behavioral problems, the challenging behaviors that can come with later stage dementia. We sometimes see antipsychotics used there in older adults, and that's a very major concern, I can say, of side effect that the really we have to think carefully about the benefits and risks of antipsychotics in those situations. But the antipsychotics, some of them have the anticholinergic effects, some of them can cause drowsiness, some of them can lead to confusion. So we need to be very careful. So that's an idea of some of these high risk medicines that we would consider not age friendly. Certainly on occasion, short term, or one of them might be an appropriate medicine for an older person. So I don't want to do a major scare. I just want to do a major alert that you want to talk to your doctor and pharmacist about the medicines, the types of medications that your loved one is taking or might be you. My next slide about the medications is about age-friendly medication use. How can we be more preventive, more proactive with the medicines we use to make sure we can be in line with the 4 M's and have better health outcomes? meet what matters most to the patient or the individual, avoid mobility challenges or changes in the cognitive function. So I encourage you, and this is where I just am so glad to be able to share this kind of information and tips for you. Um, Talk about medications at every visit. What's the goal of therapy for that drug? Is the medicine still bringing benefit? Oh, Brianing, sorry, the typo there, bringing benefit to the older individual. Because sometimes the medications are no longer needed and we can pull them back, stop them, reduce the dose. And what are the potential downsides of continuing the medication? Is there enough benefit compared to any possible risk? And if we would stop it, what's the downside? So it's important to think about both sides of the medications, but not to assume that a medication, once started, is going to stay on that medicine list for life. It's important to re-look at the medications on a regular basis. And I like to say once a year, get a really good medication review. But I say here at each visit, if the medicine is used to treat something specific, you could say we can pick a blood pressure medication, for example. Is the blood pressure being controlled? Do we need to add something? Is it maybe overly controlled and we need to reduce the dose? Maybe the person has started exercising and lost weight and we don't need as intense therapy. So these are all things that need to be considered. Deprescribe medicines where possible. Another big word here, deprescribe. I want you to be familiar with it though. It refers to reducing a dose or stopping medications that no longer are needed or that even could be harmful. So again, certainly age-friendly medicines will not, we want to use those age-friendly, avoid the non-age-friendly medicines that I talked about on the previous slide. And as we go through life, sometimes lower doses are appropriate, if not fully stopping a medication. So it's really important to talk about that deprescribing. Simplify the medication regimen. Make sure it's something that the person can manage. And if you're the caregiver, you want to make sure that you know how to give the medications, and it's as I would say as few times a day as possible, right? Great to have everything once daily, maybe twice daily, but we want to make it a regimen that is manageable on a day-to-day basis so the person can take all of the medicines appropriately, the ones that they need to take. So improve that safe medication. Oh, so to simplify the regimen, talk to your pharmacist. That's what we're here for. We know when the timing is really important, how can we can adjust the medications to fit with your schedule. Improve safe medication management at home. It's important to know how to use, if it's an injectable, how to use that injectable. If you have to measure a certain amount, certain number of clicks, how do you do that? If it's an inhaler device, maybe for a breathing condition, it's really important to know how to properly use and clean and maintain that inhaler, for example. I have on here also safe transitions of care. And as I mentioned, transitions of care earlier refers to a person moving from one place of care to another place of care, hospital to home or to a rehabilitation facility. It could also refer to different doctor offices, right? Because the different physicians might have a little bit of a different medicine list, or you never know. There's different records at each office, for example. But to be safe during these transitions of care, it's important that the patient and the caregivers are knowledgeable about how to manage the medications, how the time of day to give the medicines, how to administer the medicine properly, like I mentioned, inhalers or injectables, patches. All these things have different ways that they need to be given, administered. So it's important that you know how to manage those medications, getting refills, keeping track of the pill organizer, however that might go. And I just have on here some essential information that people should know about their medications. Again, whether you're a caregiver or the patient, the name of medication, the dose, the frequency, how often it's given, why is the medicine being prescribed, what things need to be monitored for either safety, looking for side effects, or for effectiveness to know if the medicine is working. How long do you need to take it? And when do we reevaluate if the medicine could be stopped? So, how do we advocate for this age-friendly system? I hope you kind of see why paying attention to those four M's can lead to better outcomes when we really focus on what matters most to the patient and make sure the patient is involved and participating in developing the care process, the care plan, I should say. I'm sorry. So, caregiver awareness. I want you guys all to be aware of these 4 M's, that you need to make sure you're involved in hospital discharge planning before the person is coming home, that you're educated on how to manage the medications or any new medicines. Maybe something needs to be stopped. If we're adding a new one and something else should be stopped, but what is the correct, accurate medication list if a person is coming from a hospital to home? I talked about knowing how to help the person move around, ambulate, right? Transfer from bed to chair or whatever it might be, how to use a walker safely or a cane. And then support of the person in the home setting, right? So, what information do you need to make sure the person can move around at home safely, manage the medications? Are there any cognitive impairment, right? Decreased memory or confusion that might increase the risk of being safe at home? Um, so we want to ensure that the patients can self-manage the care or the caregiver and maintain their independence. So it's really important that you communicate with your healthcare providers about all these concerns or any of these concerns that have to do with those 4 M's, right? So the next slide is a tool that you can access from the IHI website, the Institute for Healthcare Improvement, has a my health checklist you can access and use this tool to help prepare for the next doctor appointment so that you can talk about these 4 M's. If you are a caregiver of an older adult, you might be able to bring up the topic of let's of doing this checklist before you talk to the doctor, by saying, I want to make sure we talk about what's most important for you so you or we can have a more useful conversation with your provider. And that comes from the website, that quote. So you can download this booklet. It's about, I don't know, 12 pages or so. And it goes through, it's like a workbook, if you will. They call it a checklist, but it addresses each of the M's. So on the What Matters page, there's prompts for all of these questions and suggested or gives you ideas for some possible answers. But you really have to think about what's appropriate for you. So for the What Matters page, what are the most important things in the person's life right now? Um, and things that you could think about of that you can want to make sure you're able to communicate and be in touch with loved ones. Maybe you're adjusting to a new life situation, you've retired, there's some concerns or questions going on. So what's most important right now? What's going well? What are activities that you or the person enjoys? What are the highlights? What's good? And then what could be better? What are some of the concerns or things that you wish were a little bit different or something? And then listed any additional information the provider should know about your situation right now. You're worried about finances, or you're worried about a grandchild, a grandson situation, or you're someone who was a driver for you or assisted you, maybe is not available right now. So what are things now that the provider should know about? On the medication piece, it's important to have all of the medications listed. So I always talk about the importance of including 3 categories of medications: your prescription drugs, your OTC products, and any supplements or vitamins that you take. So that current list is really important. So get that together when you prepare for a doctor visit. And then there's the questions about what's going well with your medications. Are they effective in helping your pain? Is the constipation doing better? Whatever it might be, what's going well? And then what could be better? Are there side effects? Are you struggling with when or how to take medicines? Can you afford everything? So what could be better? And then any questions or concerns for your provider. Under the mood and memory, or that mentation M, what is the situation now? How happy are you? How worried are you? How are things going now? And then what's going well and what could be better? So the same types of question, but really focusing on the mood and memory, depression, cognitive function, that kind of stuff, right? And then questions or concerns for the provider to make sure you have everything at the tip of your tongue, tip of your tongue. It's in your head. You want to make sure you're ready to talk to your doctor about it. And then in the mobility piece, think about how the person gets around. What's the situation now? Again, I referred to earlier moving around within the home or perhaps transportation when you go out of the home. So think about mobility in those two different ways. What's going well? What could be better? And then questions for the provider. And then, like I said, there's prompts in the workbook and ideas of how to answer those questions. Once you kind of go through that workbook, that checklist, as they call it, go through all the answers. And you, as a caregiver, can help the older adult do this maybe. Review all the answers and prioritize, they suggest, the top 3 questions or concerns that you want to talk to the provider about. And how do you narrow everything down to 3? That can be challenging, right? So it might be a matter of talking it over, perhaps with you, if you're the caregiver, a trusted person that can help think through what might be those 3 priorities for that at that point in time, for that visit, knowing that those answers can change over time. We're not stagnant people. Things change and move as we go through life. And then at the next appointment, start the conversation with the provider. Ideally, every clinician is going to be well familiar with the age-friendly care and bringing up these kinds of questions for you. But until that happens, take it on you to be your own advocate and start that conversation. I have a couple of things that are really important to me. Can we talk about them? And then bring out your list with those top 3 questions or concerns. Kind of in wrapping up here, there is something called an age-friendly designation. So hospitals, clinics, home health organizations, for example, even pharmacies can get recognized as an age-friendly health system by confirming, certifying, if you will, that they follow certain procedures that address the 4 M's with patients at every visit. An example I can give you is I'm very involved with one of my pharmacy associations called the American Society of Consultant Pharmacists, and we have partnered with the age-friendly movement to provide badges for pharmacists so we can say we're age-friendly pharmacists, and we have some age-friendly pharmacy champions out there spreading the word. So I am an age-friendly pharmacist. I completed my little badge training that just says I'm well familiar with those 4 M's, and I will bring that to each encounter. So how can you be an age-friendly 4 M champion, right? As a caregiver, as a patient, you have a stake at the healthcare that's provided. You have an interest in making sure everyone on the healthcare team, the clinicians, the therapists, whomever, are all focusing on age-friendly care as modeled by those 4 M's, if you will. So with that, I would love to open it up for questions and bring back Donna and Rachel to help me out with the next phase here. But I will share that my book is called Maybe It's Your Medications. It's a really neat resource for those of you who want to delve into a little bit more of what should I know about medicines to use them more safely, and how do I talk about my medications? I want to be more engaged with my healthcare team, just like using these 4 M's when we talk about those age-friendly medications. There's some good information in that. So check that one out. I have a monthly newsletter if anyone wants to subscribe to that, and ways to reach me. So that's my little, I'll turn it back over, bring you guys in, and I thank everyone for their time.
Well, thank you as well. We really appreciate you, Dr. Heva, for today's education. And it was a lot of great, really good information that I'm sure our seniors most definitely will benefit from. So much to learn. I know I did. So I don't see anyone. Rachel, do you see anybody if for any questions or anything? You don't see anything?
Think I
Okay.
have any on Facebook.
Okay. Well,
Get some practice.
we'll also be posting it to the YouTube page as well. So you never know, somebody on there may end up reaching out, or
Yeah.
if they want to reach out to Agent Advantage to get to you, we most definitely would do that as well. But we do want to thank you very much for your time and attention today, and hopefully everybody have a very good 4th of July.
Yeah. Thanks so
Enjoy your
much.
time. Be safe.
And happy
And did
holidays. Have a
you,
great weekend.
thank you. Rachel, you have any words for us? Are you okay?
I'm good. I'm just taking it all in.
Okay, great. Well, we appreciate everybody. And thanks again, Dr. Hedva. Take care. And you guys have a great rest of your afternoon. See you next
Y'all
time.
too.
And join us back. I forgot. We'll be back on at 3:30 with another educational talk. So if you have the time, anybody, everyone, come on back and see us again. Thank you. Take care. Bye bye.